Dr. J welcoming you to the final video in this series in which we are going to talk about neonatal jaundice or jaundice of the newborn. Now this is a fairly common condition. It gives rise to yellowish tinge in the skin, so the face, the chest, the abdomen looks yellow, and also there is a yellowish tinge in the white part of the eye, that's the sclera of the eye. Now sometimes young mothers get very worried and they confuse it with infectious hepatitis or infections of the liver. This is simple neonatal jaundice, which is a mild condition. It lasts from a few days up to 2 weeks and then goes away. However, I always suggest monitor the color of the skin of your baby. If you find it getting very yellow, take the baby to the doctor who will perform a simple heel prick test to see the level of bilirubin. Because sometimes if the level of bilirubin goes over 25 milligrams, then that can be a cause for concern and can lead to brain damage. Now there are basically 4 kinds of neonatal jaundice. The most common is called physiological jaundice, which appears in about 3 to 4 days after birth and goes away in about 10 to 15 days. And it is simply because of immaturity of the liver. So as the baby grows in a few days' time, the liver becomes mature and then the jaundice goes away. The second one is jaundice of prematurity. When babies are born prematurely, obviously the liver is not mature and that's why they get jaundice. The third is breast milk jaundice. Now this happens in about 1 to 2% of breastfed babies. The mother sometimes produces a substance that comes out in the breast milk and gives rise to jaundice in the newborn. This jaundice may take a little time to appear. It may take about 5 to 6 days to start appearing and takes about 3 weeks to 12 weeks. So that this one can take a little time to settle down. The fourth one is called blood group incompatibility. If there is an incompatibility in the blood group of the mother and the baby, an Rh incompatibility or an ABO incompatibility, that can give rise to jaundice in the newborn. Now this jaundice can happen very, very rapidly, even in the first day after birth, because the mother produces some antibodies in her bloodstream which go and cause hemolysis or breakage of the red cells in the newborn and gives rise to jaundice. Now, many years ago, this used to be a big problem. The Rh incompatibility was an issue, but now there is something called an Rh immunoglobulin injection which is given to the mother within 72 hours after the birth of the baby. Now this will help in subsequent pregnancies. So the babies born after this one will not be at risk of having the incompatibility. Now the treatment of jaundice is fairly simple. Number one, as I said, it's a self-limiting illness condition. It goes away in 10 to 15 days time. All you need to do is just give some extra fluids to the baby. If the serum bilirubin level is rising, then the doctor will admit the baby and put the baby under what's called the blue light or the phototherapy, which helps to reduce the bilirubin level in the next few days. However, if the serum bilirubin level is very high and goes over 25 milligrams, then the pigment can go into the brain and give rise to brain damage. In this condition, the baby needs an exchange transfusion where the blood of the baby is exchanged with blood from a donor. But as I said earlier, fortunately, neonatal jaundice in most cases is a trivial condition and goes away soon after birth. Thank you for having watched these videos with me, and I hope to see you on another course soon. Thank you.